continue covering many parts of the face and body with Dr. Rhys
Right.
Branman as he steps in here. But today's something I know a lot of people complain about or they hear, are you tired? And usually it's those droopy eyelids, right?
And you know, it's one of the first things that people notice about the face is the eyes, and you sort of focus in on that. And a lot of times people come to me and they'll say, you know, people tell me I look tired, but I'm not.
Right.
And they go, what can I do about that? And many times it's either an upper blepharoplasty, which is the sort of technical term for eyelid, or a lower lid blepharoplasty.
Okay. Is there a certain age this starts showing up?
You know, we see it sort of late 20s. That's sort of rare. But then we see it all the way into the 60s, 70s.
Okay.
And you know, one thing is, it's interesting is that some people come to me and they'll say, you know, my eyelid's dripping, but really it's the brow. Because if you think about it, the eyebrow and the eyelid are this component that work together.
Okay.
And so many times we'll address not only the eyebrow, but the eyelid too.
Both of them.
Both of them at the same time.
Because they are so connected.
They are, very connected.
Basically the same thing. All right, we've got some pictures so you can maybe show us a little better what you mean. And these are some before and afters that you've done.
If you look right here, do you see this sort of hooding area where the eyelid has sort of dropped down and you can't see that natural crease that occurs?
Right.
Part of that is because the eyebrow is dropped also. Now after a blepharoplasty, you can see that natural line, that wonderful line that everybody likes to see that allows us to see the eyelid again. And if you look at it, we've brought the brow up a little bit, but it doesn't have that sort of deer in the headlights kind of look. Like I'm like, oh my God, I'm overdone. This is just a natural, clean look, and it's very nicely done, and that's the kind of look that we're really going for.
We'll look at some more pictures here. I think a lot of women notice that they don't have anywhere to put their eyeshadow anymore. You know, I think that's when a lot of them realize that the eye is drooping or the eyelid is drooping.
Or they have to do this. Oh, I can't get my eyeshadow on. That's right.
Okay, so here's another picture.
Here's another one. Same sort of thing. You see this sort of hooding right here. The brow is down. Now, we didn't do anything with the brow in this case. What we did is we gave her just a little bit more of that natural curvature of the eyelid and allowed her to be able to, like you said, put on that eyeshadow.
Right.
And it's a very nice way of doing it. And it's natural looking.
Gives it that natural look.
That's right. It's sort of, I've brought back time, you know, we moved the clock back about sort of natural look that she had many years ago.